My name is Morgan, and I work at South Dakota State University as the program coordinator and retention advisor for the American Indian Student Center. My daughter's name is Clara Marie Osborne. She will actually be 2 months tomorrow, so time has gone very, very fast. I was just really impressed with how hard they worked to kind of make that experience about me. You know, they weren't just kind of brushing off my concerns when I would come to them with probably the most stupidest things ever, but they were just like, you know, being very kind and patient and answered all my questions right away, and, you know, weren't just kind of being like, oh no, you're fine, because to me I wasn't. So, you know, it was really nice to have that reassurance. I adore Dr. Gudvangen. Like, we had such an amazing experience, and he was really reassuring. He really told me everything that was happening. You know, it wasn't like he was trying to be like, oh yeah, you know, it's, you know, this. It was, you know, a very again, reassuring. It was very reassuring to have somebody who was very upfront about the things that were happening, what was happening, what was going to happen, and very encouraging. So him and his nurse Mandy were amazing. So, and me and my husband both were very impressed with the experience. I felt like I was being listened to, which to me was a huge deal, because again, going through new experiences and, you know, not really, and these are huge life-changing experiences. So having felt like people were actually listening and taking you seriously, or taking me seriously during the process, was very helpful. You know, and I had a situation I was probably about 33 weeks, and I actually got really, really dehydrated, and I was hospitalized overnight. First time I ever stayed in a hospital overnight. So I was like, that in itself is interesting. But, you know, they took really good care of me, and they didn't judge me for the fact that, oh, I probably wasn't drinking enough water, which, if you know Dr. G, was his big thing. And I was like, don't tell him, because I was like, don't get me in trouble. But, you know, they were very, very understanding, and they really did make an extra effort. Really made a point of trying to come to all of my appointments with me, and, you know, Dr. Gudvangen would talk to him and Mandy would talk to him, and it wasn't like he was being ignored throughout the whole process. So I think it made it easier for him too. You know, him being a first-time dad, and, you know, sometimes they forget that it's just as worrisome for them, you know, going through those experiences too, especially if they don't know what's going on. You know, Clara wasn't due until December 19th, so she actually came 3 weeks early. So that was really intense, because, you know, labor came on very suddenly, and it was like, okay, now these contractions have started. We have to go to the hospital. We got there, and they got us in. We were up in the delivery room, and it was like I had a whole team. Like, suddenly there was all these women who were there who were telling me, yes, you can do this, and you're gonna do amazing. And before I knew it, you know, I was pushing, and then there she was. And that was just that fast. I felt like I had like all these people who were on my team, and I loved that. So and looking back, I think that made all the difference. Afterwards, you know, we were at the hospital, and they helped really get me set to go out the door, and made sure that me and baby were both healthy and ready to go, which I thought was really important, because I had some issues right away after she was born. And they did a great job, but I was like, it just went fast, you know. I wasn't ready for when I was time to go back to work. So, but it was really good. They were just all about wanting to help and answer questions, and, you know, just coming and chatting with me about, you know, how I was feeling, how I was doing, how did I, you know, feel about having baby, and how was husband, like. So they were invested and interested in what was happening. So I appreciated that because it made me, it just made me feel very comfortable. I would definitely recommend Brookings Hospital. It was great. Like, and it's, you know, and I had such a wonderful experience, and There's so many great individuals who work there, and so many great individuals who work in labor and delivery. So every one of them that I met or came in contact with were very pleasant and warm and welcoming and just wanted to help however they could. So that was great.